Hi Jack, thanks for coming in today. Have you come for your asthma review?
I have, yes.
Good, not seen you for a little while.
No.
Okay, well, thank you for filling in the questionnaire. It's really useful to get that through. I've got that here. We're going to go through today and just talk about your asthma and see how your asthma's going and see if there's things we can do better. So first of all, can you tell me how long you've had asthma? When were you diagnosed?
When I was about a teenager, I think.
Right, and you remember being breathless or wheezy or whatever, having inhalers, and then things were better?
Yeah.
Good, so that's good. I've looked back in your notes and that looks okay. Okay, how's your asthma at the moment?
Mostly okay, I'd say.
Okay, so you say mostly. Are you getting symptoms sometimes?
If it's like winter time, it tends to be a little bit worse. And since I moved from the countryside to the city, it's been a little bit worse, I guess. But besides that, I'd say it's mostly fine.
Okay, so you've got two inhalers. You've got a brown inhaler and you've got a blue inhaler.
Mm-hmm.
Are you taking those regularly?
Mostly just the blue.
Mostly just the blue, okay.
Yeah.
How often are you taking the brown one? Are you doing that just as and when? Or are you doing that once a day or twice a day?
Sometimes, multiple times a day, sometimes not at all, really.
Right.
Mostly just the blue.
Okay, it's good to know. It's good to be honest because then I know where we're going from. Okay, when you say you use the blue most days, once a day, twice a day?
Once a day.
Okay.
And then unless it's particularly bad, but it's mostly just once a day.
Okay, and does your asthma ever wake you up at night?
Only if I've got a cold or something along those lines.
Excellent, good. Okay, has anybody taken the time to tell you what asthma is and how your inhalers are working?
They probably did when I first got diagnosed, but that was a long time ago, so I can't really remember an awful lot, to be completely honest.
Okay, I'm going to run through it then because we might be making some changes to your inhalers.
Okay.
So I'll do some very undetailed diagrams on here.
Okay.
So asthma affects your lungs. Your lungs are quite big, so they go from sort of underneath your collarbone to the bottom of your ribs, so big bags there. And asthma affects the tubes that run through your lungs, not the tissue itself. And what happens with asthma is the lungs get swollen and inflamed. So the tubes should be around, they're clearly not that big. And when your asthma is well controlled or you don't have asthma, you have a lining that lines those tubes. And it's the same one as up inside your nose. And when things are all okay, the lining is nice and close to the edge like this. So it leaves a nice big hole in the middle for the air to whoosh in and out. And the lining's there for a reason. The lining's there to moisten the air as you breathe in and out, to trap foreign bodies, those types of things, okay? Now, what we know is when asthma is bad or when asthma is not being treated properly, that lining there gets swollen, okay, and it's got nowhere to go. So what it does is it swells into the airway, so it looks a bit more like this, okay, and you can see the hole in the middle is smaller, so it's going to be harder to breathe. And then the second thing that happens as a result of that is around the outside, you've got a muscle, and it's a muscle you can control because you can hold your breath, you can make yourself cough, but on the whole, it's under the control of your nervous system. So if you hold your breath for too long, for example, your brain will make you breathe, and if something goes down the wrong way, you cough. And we know that when this lining is inflamed, this muscle here gets very twitchy. And when it comes into contact with something it doesn't like, so that might be cold air, it might be smoke, it might be perfume, anything like that, it goes into spasm and it shuts down. So that makes it even more difficult to breathe. So the inhalers you've got at the moment work in different ways. So your brown inhaler works on this inflammation here. When you take a brown inhaler, you don't feel it working. That's not the idea, and that might be why you're not taking it, because it doesn't feel like it does anything. Is that your experience? Mm-hmm. Yeah. You need to take it regularly so that it shrinks the airway back to where it should be, and then you need to continue taking it to keep it in that good state, okay? And if you get this right, this muscle is less twitchy. However, if you get some twitch here, so that'll be when you cough, when you wheeze, when you feel more short of breath, your blue inhaler here works very quickly to release the spasm in the airways and open it back up, and will last for about 4 hours. If we don't get this right, this bit here is not going to work. Okay. So your brown and your blue inhaler, I know this is white, but do they look similar to this?
Yeah.
Maybe a different mouthpiece shape. Yeah. Okay, so I'll give you a new one. What I want you to do is I want you to show me what you do, how you take a dose. I'm going to just, because it's a new one, there we go, just make sure it's working. Okay, show me exactly what you do when you take your inhaler.
So I'll take a breath out. And then
yeah. Okay.
And then hold and then there you go.
That's not best, but I think what we need to do is, rather than try and get you to do something different, we need to give you an inhaler that suits you better.
Okay.
Okay, so there's a couple of changes I think would be really good for you. So it really is important to get this medication in to get the airways under control. And actually, if your asthma is well controlled, you shouldn't be having symptoms. You shouldn't be needing your blue inhaler, except very occasionally, and you should be doing all the things you want to do. So when your asthma's bad, does it affect your daily life? Do you stop doing things?
Yeah, I tend not to play rugby or anything. If my asthma's playing up, I try and take it as easy as possible, and again, I use my blue inhaler a little bit more, I'd say.
Good. So that's not what we want. We want to get away from that, and that's partly because the regime that you're on at the moment is quite old. We've got some newer medications and things are changing, and they're changing for the better. So what I think would suit you really well is this inhaler. Now this one's red, as you can see. Now what this one does is it contains 2 ingredients. So it contains the steroid bit, the bit that damps down the inflammation, and it contains something that is akin to the blue one. So your blue one works quickly but only lasts for about 4 hours.
Okay.
The thing that opens up the airways in here works as quickly, so within minutes, but it lasts for 12 hours. And the idea with this one is that every time you are getting symptoms, every time you're needing to take your rescue medication, you use this one. So you use this one morning and evening routinely, and you use this for your rescue instead of your blue. Okay, and what that means is you get the airways open, but you get a bit more steroid in to try and get things under control. So it should head off those horrible weeks when you can't do stuff. Yeah, okay. It's called what we call a MART regime. So that's maintenance and reliever therapy. Advantages to you: 1 inhaler, 1 thing to remember, 1 prescription charge. Okay,
Perfect.
instead of 2, so that's always a bonus. Now, easy to use. So you take the cap off, you keep it upright, you twist the bottom and you twist it back, and that's primed it. And then you need to have good posture. So if you're sitting, sit up straight. Better if you're standing. You're going to breathe right out until your lungs are empty. Seal your lips around the mouthpiece, and then breathe in hard and fast, like you did with that one, really. Hold for 10, and then gently breathe out. Okay, and you just need to do 1 puff. Okay, and then if it's your regular ones, brush your teeth, rinse your mouth around afterwards. Okay, there's no medication in that. Give it a go. Show me how you can do it.
Okay. So twist to prime it.
Yeah, did you feel the click there?
Yep.
Yes, it's quite an obvious one. Yep. Breathe out. Good. Good seal. Big hard breath in. Okay, the only thing you're doing wrong is you've got your hand, I didn't tell you that, you've got your hand over the bottom, so hold it there, because the air needs to whoosh in here to get the dose. Let's have another go.
Okay, so
Good.
prime it.
Hold it by the bottom. Good. And then 90 degrees when you take your breath in. Good. Good. Hold for 10.
Then hold for 10.
Good. How'd that feel?
Easy.
Okay, now, whereas you can feel the puffy ones puffing in, that one's designed that you can't feel it and you can't taste it. Okay. It has got a dose counter on it, on the side here, and it is quite small, but it does go red to draw your eye to it when it's getting empty, so you know how many doses you've got left.
Right, okay.
Because when you're using them as and when, it can be a little bit difficult to remember. Okay, I was going to ask you about a spacer. Have you got a spacer anywhere?
Somewhere. I tend not to carry it around because it's quite big.
Okay, so that's the other advantage of this. You don't need a spacer.
Oh, perfect.
So you can just get rid of all that. Just going to use this. Any worries? Are you happy with me changing your blue inhaler and upgrading you to a new regime?
100%, yes.
Excellent. Okay, what I want to do is I want to do your prescription, send it to the pharmacy, and I'd like you to come back and see me in about 6 weeks to tell me how you're getting on. But if things aren't right, if anything's worrying you, if you've got any questions, you need to ring sooner. The other thing I didn't mention, as we're at the end of the consultation, what do you do with your empty inhalers?
Not really ever really entirely too sure when they're empty until they're just sort of not working.
Okay.
But I know I have to just chuck them in the bin because they're not recyclable, right?
Okay. Again, things are improving. So we don't have a recycling scheme as such, but it's better when they're empty if you take them back to the pharmacy. So when you pick up your new ones, take your empty ones back, and they've got a sort of a way of disposing of them, which means that it's more environmentally friendly.
Oh, perfect.
The other thing with this one is full of gas, which is damaging to the environment. This one doesn't have that gas in.
Okay.
So all in all, it's quite a good thing to do.
Yeah.
Any questions?
None at all now.
Okay, we'll do you a personalised asthma action plan, so you've probably got one of those somewhere.
Somewhere, yeah.
But it will be different with this one. So I'll do you a new personalised asthma action plan for you to take with you. In fact, I'll do it online and I'll text it to you so it's on your phone.
Perfect.
Okay, and then I'll see you again in 6 weeks or so, but sooner if you've got any problems.
Wonderful.
Okay, no questions?
None at all.
Perfect.
Thank
see
you
you
very much.
soon. I'm doing it off now.